What's up, guys? Thank you so much for joining us today on the first ever Cynical clinical video cast here. So in the introduction, I probably already referenced Shanae, Whitney, and Aaron. We're gonna open up with just a few quick introductions just so you know a little bit about everybody here. Shanae, would you like to start?
Yes.
Let's do it.
Hello, everyone. I'm Shanae Ammons. I'm a physical therapist. Got my doctorate in physical therapy from Texas Tech University Health Science Center. I graduated back in May of 2020, and I'm currently working in an outpatient orthopedic clinic.
All right, we'll shift it over to Whitney real quick.
Hey everybody, my name is Whitney Mills, and I'm also a new graduate. I graduated from Texas Women's University in May of 2020, and I'm currently working in a fast-paced outpatient orthopedic, and I've been practicing for about 3.5 months now.
And crushing it. And Aaron, just real brief, man.
I'll try. I have a hard time with that. But I'm Aaron. I'm the old therapist in the clinic. I've been practicing for about 13 years, most of which is in outpatient orthopedics. I graduated from a school in Buffalo, New York called Evil College with my doctorate and went on to further my manual skills and got my fellowship training in orthopedic manual physical therapy. So.
Nailed it. All right, that's perfect. So again, in the introduction, I probably already mentioned the purpose of this is really to highlight the new graduate experience coming from a student to a new graduate, that transition and what that's like. So Shanae and Whitney, about to ask y'all one question. Aaron is not involved quite yet. So what do you guys feel like school did prepare you for? Y'all are in a very high fast-paced is the words I'm looking for, sorry.
Yeah.
Fast-paced clinic here, y'all are seeing a high volume of patients just right off the bat. What do y'all feel like school prepared y'all for in this type of environment?
Yeah, I'll start a little bit and then jump in if you think. I do think it is a little different experience jumping into this type of clinic that we are in with the fast-paced, high-volume, complex chronic cases. So my experience, I feel like, is a little bit different than some others maybe. But I think for me, just the baseline foundational knowledge of knowing what are we assessing and what are we looking for, starting with the subjective. And I think that's the biggest part of having a good, confident kind of structure as far as where my questions go with the subjective, and then just knowing how to follow up with the basic clinical exam just to get some objective measures and just have a good idea of what's going on. And then that gives me kind of the baseline on where to go from there to go through differential diagnosis and some other things in that direction. So
Yeah, and I would agree. I think my school did a pretty good job at the subjective stuff and like what to ask. Not a lot of like follow-up to those questions, sometimes is like, okay, these are all good answers to ask, and where do you go from there? I also think that I was pretty well prepared for evaluations. So, like, okay, this is kind of how you start one. These are all the special tests. This is like, is this positive? What does that mean? The specificity and reliability of all of those. So I think I was a little prepared for that. And also a lot of like multitasking, time management skills. I feel like I was prepared for this type of clinical for me. So
Nice, absolutely. And to contrast that, what do y'all feel like y'all are struggling with? This one thing that you feel like you're struggling with, what are you having a hard time adjusting to in this type of environment right now?
do you want me to start?
Sure.
Okay. So definitely billing. I'm sure all new grads are like, what? Yeah, so that was pretty challenging, and I still struggle with this. I'm like, what is this insurance? I don't even know what it means, so that's definitely been a struggle. Definitely still struggling with more involved cases. So I don't feel like I was super prepared for like somebody that's got shoulder, neck, and a little bit of back pain, Definitely more prepared for more of a like, okay, this is rotator cuff, what do you do? But then again, I'm now learning that it's never just the shoulder, right? So
Things that don't fit a specific
yes,
pattern.
Yes,
Okay.
absolutely.
Very cool. And
I'd agree with all of that,
all of that, there
honestly.
you go.
But I also think too, just going off of what I said earlier about, I really felt prepared for kind of having a structure to the subjective, objective stuff and initial eval and how that goes. But also, I think it could benefit more from knowing the why, and we have this discussion in the clinic a lot of knowing where to go from there and structuring your the rest of your treatments to really hone into the specificity of that patient and how they present individually, and then just kind of knowing where to go from there to make the most effective treatment for them.
Okay.
And if I may jump in, You're trying to shut me out. But I'll get in there somehow. And this isn't bringing to light, how the schooling is for each individual person. I think it's important to note that every school is doing their best to try to educate you on the global aspect of physical therapy. And we're just trying to highlight what that means as far as your orthopedic experience, whether it's schooling, clinical outcome, first coming into the clinic, what your experiences are like. So it's not to say that they didn't prepare you enough or they over-prepared you. It's just to get a baseline of what new graduates and new PTs are feeling and getting their feelers in the field and digging in what that really means. So that's coming from me.
Yeah, I think that actually helps me transition into my next question. Do you feel like you have a good grasp on how to correct that struggle or fix that struggle or get better at whatever you feel like you're struggling with?
I think I am working towards that, and I think the biggest thing as a new grad is to know that the learning is not over. It is not graduate and go make money and live your life. It's a constant struggle to keep learning and pushing yourself to dive into the research, dive into what's out there, investing in your time to find a mentor. And that's been the biggest thing for me, is asking questions to the people I'm surrounded by and reaching out and saying, do I need to continue with pursuing a fellowship or something down the road to help me grow into just prepare, just more knowledge really is what it comes down to. And so I think that's just been the biggest thing for me, is finding that mentorship, having people that I can go to who I know are smarter than I am and have more experience than I do, and just being open to learn.
Yeah, and I would 100% agree. I think I'm just now getting to the point where I kind of know how to correct the struggle. And so I definitely am trying to just challenge myself more, getting out of my comfort zone and being like, okay, I don't know what's going on here. Let me ask you guys, because you know a lot. And then also more practice. I feel like I can do 100 different necks and then I'm still like, what is going on with this person right here? So definitely more practice for me, and then challenging myself to really ask myself, why am I doing this? And me and Erin have talked about this, but I see something in a shoulder patient and I'm like, okay, let's strengthen your rotator cuff, but why is their rotator cuff weak? Is it coming from the neck? So I think continuing to ask myself those questions is what's going to help me get over this little struggle.
Yeah, I think I would totally agree with both of those points to some extent. I think having a mentor was huge for me personally, and then reps. Every mentor I had said, get your repetitions in. So there's really no two ways around those things, I don't think.
Absolutely.
Erin, did you have anything specific you would like to
Yeah,
add at that point?
I can just add in that, personally, they're talking about getting in reps 100 patients, and with the current landscape of how our field is going, I didn't feel comfortable with a neck until I was 200 hours into my fellowship mentoring, and then it clicked, right? And it might be different for everybody. I'm a little late to the party, but I think that just understanding that is a huge point, and that it takes that time, and at some point it clicks. So
Sure.
everyone's different.
Can't rush it though.
Can't rush it.
I think an interesting thing here is the perspective that you have as a student. I remember feeling completely different from a student to a new graduate. So Shanae, how would you say your perspective has changed regarding our field, this practice, what you expected from a student to now actually working in a crazy environment?
It's different too, and it's hard to really nail down why it is so different. But I think the biggest thing for me is I went from having someone with me kind of telling me what to do, and yes, we'd talk through it, and I'd say, this is what I think, and they'd say, great, go try it. And now it's like, okay, it's all me. You don't have someone looking over your shoulder, making sure you're doing everything the right way, the best way, all those things. And so I think that changed my perspective as far as just my approach to therapy, and saying, okay, we're looking at this patient from start to finish. It's no longer, okay, I'm just seeing this patient for a clinical for a couple weeks. I jumped in at various points within their treatment. I'm here from day one until they're gone. And so it's really just trying to be able to see it from a global perspective, or from, okay, here's day one, where do we see them 6 weeks, 8 weeks down the road, or is this a longer process? Is this going to take a while? And so it's really just getting the full view of that.
Sure.
Yeah, I would agree. So as a student, kind of short rotations, but each rotation you were taking, you know, kind of how your CI practiced and what they did with patients, and you were like, oh, this is easy, you know, like, what is there to be, right? Like, you didn't run into a lot of struggles because you had somebody there constantly helping you. And then at that point I was like, okay, you know, I'm gonna graduate, gonna hopefully pass my boards, and then I'm gonna know how to be a PT, you know. And then that's definitely not the case. But also a little bit change in perspective is I feel like we're undervalued. And again, I could be a little biased, but I feel like as a student I didn't realize that, like, some patients have to ask their doctors for physical therapy. Like, that blew my mind, finding that out. And so I know we can get on a whole rant right here, but I think my perspective there has changed too, because I'm a little upset that has been now kind of my viewpoint, that we're a little under-respected sometimes. And so that's changed a little bit too.
And I agree, and I think it's from both sides, from that perspective, but also from patients and just the community and just knowing who we are and what we do.
Yeah.
There's just a lack of knowledge from that perspective, and we've had that conversation a lot, but it's that people just don't know what is PT and why and who's most appropriate for it.
I feel like y'all picked up on that very quickly.
Yeah.
Yes.
Not having
Yeah,
worked real.
Not that we're cynical anything
No, that's not.
at all.
That's not the title of all of this or anything like that. So, Aaron, I want to tweak that question a little bit
Sure.
for you, because your path has been a little different. You were a PT before PT was a thing, from what I understand. So you started like
Yeah, with the dinosaurs. Yeah.
right. That was
That was
just
me.
dinosaur joke somewhere in there. But yeah, if you wouldn't mind just kind of walking us through, how has your perspective changed from, if you can remember, being a student to
Going back.
Try real hard.
working for a little bit, and then you
Yeah.
actually jumped into your fellowship a little bit later
I
on.
did.
So if you wouldn't mind walking us through that shift in your
Yeah.
perspective.
Yeah, I'll try to keep it as brief as I can in my long history as a therapist.
It's a long question.
Yeah. But so my program, PT school for me was totally different. Like, to apply for PT school was like, I don't know if I would get in, to be honest. Now, but we got accepted as a freshman as a 5-year program. You got your BS/MS degree, and then after 5 years, you know, it was like 2006, 7, whatever, and there was a transitional degree for a doctorate program. So I got into that, and I was able to work at 22 years old with my master's degree in PT, and then go get my doctorate. So totally different landscape than what's currently out there, and that's a whole different topic to discuss the differences between the two of those, because I think there's some important topics to talk about there. But, you know, in going through my PT career, I've done it all, like from acute care to home health to inpatient rehab to orthopedics, and I knew orthopedics is kind of where I wanted to settle. And I did traveling PT, and thank gosh I did, because I ended up meeting a PT who just, you know, he had it, and he was a little bit older than me, you know, not super old or anything. He had just gone through his fellowship training, which I didn't know at the time, and we kind of connected and talked about stuff, and made me realize that I was missing the boat. Like, I thought I was getting people well, right? But I think it literally was just people liked me. Yeah, true. I mean, PTs are likable people, right? But I think it was just the fact that people liked me, and they didn't want to hurt my feelings and tell me that I'm still hurting, or yeah, I'm better, Aaron, but then they go home and be like, oh, my hip is killing me. You know, and I think I'm doing a good job, and I'm not. Doing a full job is what I say. So he made me kind of rethink my approach, and you know, I think there are two ways that a PT or anyone really can go when they're challenged like that. They can either say, you know, I like this, I'm going to step up, I want to be that, or I'm good, and I can just
Be content.
yeah, I'm just going to hang here and live my life and be okay. And I think you do get both in the field, and that's totally fine. But I wasn't okay with doing that, so that drove me to the fellowship. So I've been working like 5 years in outpatient, had this revelation, and I was like, I need to do it. And it was all timing. I happened to be in the right area. The program was down the street from me, and just kind of dove in and leaned into it. And it was one of the best decisions that I made, because how I treated before in the previous 5 years, totally different than how I treat now. And even after fellowship, the development post-fellowship has been pretty cool to go through a transition. And I see other therapists that are going through that transition, and the questions that I had, they're having, and it's just really a nice kind of trajectory to get your career on. And I think that is super important. But I think there is a difference between going right from PT school to fellowship and what I did, because I had to see what I wasn't to know what I could be. I mean, there's a classic saying that we all say all the time: you can't be what you can't see. And I didn't know until it was presented in front of me. So I think the fact that you guys are getting exposure to just a different way of thinking is really important. So that's kind of my path.
That was a solid answer. Yeah. Very
Long-winded.
No, it's awesome, man. It's awesome. So a quicker question for everybody around the table here. So again, we work in an extremely high volume, fast-paced environment here. The stress is going to build up super quick, having to learn all these different things, deal with the time management, the patient management, worry about how effective are you for everybody. Do you have one thing you could recommend to help just reduce stress, manage stress, anything along those lines? Just one thing.
Just one thing.
Sure. Okay, I would say one thing to manage
Not just alcohol.
Dang it, that was my answer.
Yeah, that's a go-to.
Well, I was gonna say, like, in the clinic, I would say planning your day. Because, so if I know I have a few difficult patients coming in the night before, I'm thinking, okay, what am I gonna try to do with them? I have plan A, B, and C. How am I gonna go about that? Who am I gonna start with first? And then just really trying to plan out A, B, and C plans for each patient and go with that. So planning helps me.
Nice, yeah.
I would
Yeah.
be the same. I was going to say have a game plan. Know who's coming in the next day. Know how you're going to structure it. Because there's going to be loads of people coming in, and some are more hands-on than others. And knowing, are you prepared to kind of handle what's going to come? And I think what you said really good of having plan A, B, and C. I think that's important because a lot of times plan A doesn't work. A lot of times plan B doesn't work, and so you got to go somewhere.
And maybe not C.
And so knowing, a lot of times, even if it just means coming in a little bit earlier and just taking a look at what do you have going on, or maybe after work sometime just spend a little time and be like, okay, I have this going on, I don't know what's there, let's do a little research, see if I can get some ideas and some things. And so I think you said best, having a game plan is the best thing.
Nice.
I mean, I think it's better than starting your day with cortisol and caffeine.
Yeah. Winning combination. Yeah. All right, well, guys, I think for this first round of Cynical, Clinical, I think we're going to wrap it up right there. Thanks again for checking it out. I hope it was helpful. Holla at us at Power Mill Performance on the Instagram. Email us at info@powermillperformance if you have any questions. Thanks again, guys. I really appreciate it. All right, bye.